Hello, my name is Dr. Vivian. I'm a pharmacist at an academic hospital. I've been a pharmacist for about 5 years, which seems really crazy because I feel like I just started yesterday. But time really flies when you enjoy what you do. Many people ask me why I wanted to become a pharmacist in the first place, and it really came down to the fact that I wanted a job that I could help people every day. I was good in math and science, so pharmacy basically fell into my lap. And I'm glad it did because I do enjoy what I do. So because I work in a hospital, my main role really is being a medication resource to doctors and nurses. They'll call me in the pharmacy and ask questions about what medications to give for a certain disease state, what dose to give, and sometimes they'll even ask, how should we give this medication? So that's pretty much my main role. My favorite role, though, is the reason why I even got into the field in the first place, which is to help people. So what I do to help patients is basically to protect them from getting the wrong medication or the wrong dose. So a lot of times pharmacists are the gatekeepers or are the people protecting patients from getting the wrong medication. A specific example that I'd like to share is that for a NICU baby, a baby in the neonatal ICU, I noticed that a doctor had put in a medication, a dose for a medication that just seemed way too high for the baby's size. So I called the doctor and said, hey, did you mean to put this dose in for this patient? And we looked at the order together and she realized like, oh no, I didn't mean to order 2 mg per kg. I just wanted to give a flat dose of 2 milligrams. And because I was able to catch that mistake, that prevented the baby from getting a double dose of the medication that they were given, which would have been extremely harmful. So a lot of times pharmacists are the people catching those mistakes. Everybody's human. Doctors are human, nurses are humans, and of course pharmacists are humans. But we all work together to make sure that patients are treated safely. In my role as a pharmacist at my hospital, I also am a teacher to students. I am a teacher to new hires. I am usually the first person they meet to teach them how to use our electronic medical record system in the hospital. On top of that, I also dabble a little bit on the informatics side. So I'm able to run reports to kind of give us an idea of how medications are being given in the hospital. If there's any safety concerns with how the electronic medical record system is working, I help fix those problems. So I have kind of a dual or triple role at the hospital, and I really enjoy being on both sides of the spectrum. So one piece of advice that I would like to give for anybody who is in pharmacy school already or is thinking about going into pharmacy school is to really expand your mind about what you can do as a pharmacist. A lot of people kind of think of it as either I go into hospital pharmacy or I go into retail pharmacy. There's so many things you can do as a pharmacist. The sky's the limit, really, with pharmacy. To anybody who's interested in pharmacy, there's so many things you can do.